Susan Manzi, she's Assistant Chair at the Department of Medicine and Director of the Lupus Center of Excellence, Allegheny Health Network, and she's also co-chairman at Temple. She received her medical degree at Pittsburgh, M.P.H. at Pittsburgh. She was intern resident and a rheumatology fellow at Duke. And then she also did a fellowship at Pittsburgh, and she's had a Lupus Center of Excellence. She's going to give us a talk this morning on the update. It's actually been changed topic. It's going to be on biomarkers in lupus. Susan.
So anyway, it's really a privilege to be here. I cannot thank David and Pam enough. I think they set the bar in clinical conferences in rheumatology by far. And they allowed me the privilege of being a part of the National Fellowship investigative quorum earlier in the week, and it was just amazing. So their commitment to training, commitment to clinical conferences is just unsurpassed. So thank you so much. So I'm in a really bad spot, and I promise you I'm going to get you out early, because not only am I before lunch, but I have biomarker in the title of my talk, which is like, don't go there. I don't want to hear anything about biomarkers. So I'm going to make this very practical for you, and I'm going to try to convince you that you are all using biomarkers every day. We are all using biomarkers every time we're in front of a patient. We are relying on biomarkers to help us make decisions. And so I'm going to go through the Biomarker Odyssey and also try to tell you that biomarkers, whether they're blood tests, whether they're imaging technologies that may seem investigative or esoteric today, are going to be standard of care tomorrow. And so we really should keep abreast of what's going on in the field, because they may very rapidly become a part of what you are going to be doing in your practices every day. So these are my disclosures, and most importantly here is the last one. Exogen Inc. is a company that licensed technology that I was a co-inventor of that had to do with diagnostic testing using complement activation products. I have no ownership in the company, but I am a scientific co-inventor of the technology. So I'm going to talk a little bit about what biomarkers are, and then talk to you about what the potential lupus biomarkers are that everyone is studying now in the field. What's the latest in this area, both in terms of susceptibility to disease, diagnostic aids for us, disease activity, prognosticating with patients in terms of outcomes, and what organ systems are they going to develop problems with. These are a lot of the different molecules and techniques that people are using to help in this arena. And not to forget that imaging is a very powerful technology. I think about musculoskeletal ultrasound, right? Investigative for many years now, very much a part of clinical practice in a lot of offices today. So what are biomarkers? Well, the definition's pretty straightforward, but I think it makes sense, right? These are biological measurements, pretty simple. They can either be physical, which could be imaging, cellular, biochemical, molecular, or genetic. And all of these have to help us in some ways mimic or confirm either a normal biological process, pathogenic process, or some kind of pharmacologic response. Okay, they're important. And if you think about the two probably greatest biomarkers in the cardiovascular world, it's blood pressure and LDL. Why are they great biomarkers? First of all, they're easy to measure, they're very cheap, and both of them very, very accurately document a biological process. So blood pressure tells you whether you have hypertension, a pathologic condition, and LDL cholesterol tells you whether you have hyperlipidemia, again, a pathologic condition. And then even better, bang for your buck, both of those markers can then predict bad outcomes, cardiovascular events, strokes, etc. So what we're looking for, the holy grail in lupus,